Hello, I'm Nathaniel, and I'm going to be talking to you about two poster abstracts presented at the Oxford Venoms and Toxins Conference 2023 about the experience of the National Poisons Information Service with lion's mane jellyfish envenomation. So what is the lion's mane? Well, it's one of the true jellyfish, the Cyphozoa. Compare that to other highly toxic jellies you may have come across, such as the box jellyfish, the Cubozoa, or the Portuguese man o' war, an example of a hydrozoa. They really are huge. The bell is over 1 meter across, the tentacles several meters long, and they're found right across the northern oceans, including around the British Isles. They're seen most commonly in Scotland and most commonly in July and August, though at other times of year as well. So, let me take you back to a breezy August day in 2022. A 60-year-old female was swimming in the sea near Edinburgh when she was stung across her left anterior, that's the front part, upper arm and chest. The identification of the jellyfish was made by the patient herself, to whom it was obvious it is quite a recognisable jelly. So she was stung at 11 a.m. and then after a hot shower at home, she presented to A&E with severe pain in both hands and both feet, high blood pressure, highest of 193 millimeters of mercury systolic, and low heart rate of 35 beats per minute is its lowest. These are really quite deranged values. She also had some nausea and a local rash where the tentacles had struck her. She was washed to remove any adherent nematocysts, was given some IV fluids, an antihistamine, and morphine for pain control. And by 6 hours post-sting, she was showing some cardiovascular improvement. Her blood pressure had reduced to 150 millimeters of mercury at this stage, systolic. This is still slightly high, but her heart rate is normalized to 70 to 80 beats per minute. What was notable at this stage is that the morphine was proving ineffective. The pain was still described as severe. The patient described it as worse than childbirth. However, she had completely recovered by about 9 hours post-sting, apart from the persistent local rash across her arm and shoulder, and she was discharged the following morning after an assessment by a consultant toxicologist. So where were patients stung? So in the NPIS data, we've had 11 cases reported to us. Most of them were Scottish cases across a broad range of ages. Effectively, all C users in Scotland are at risk. Identification was always made based off the patient's own identification or based on description by the patient, and was tentatively or confidently reported as such. There were no independent verifications, there were no identification of any retained nematocysts, no images, no independent testing. See also the lion's mane jellyfish NPAS road trip. So that was where patients were stung. Now let's talk about where patients were stung. 3 of them were stung on the face. None of the patients stung on the face developed systemic symptoms, although swelling threatening the airway and significant pain were noted. All 3 patients stung across the torso developed severe pain or systemic symptoms. And of the 2 patients stung only on the arm or hand, only 1 developed systemic symptoms. And in 3 patients, the sting site was unknown. Most patients developed local symptoms, rash, swelling, tingling, or itching. I suspect all patients probably developed one or more of these things, but in 1 patient that local symptoms were unreported. Again, most patients developed some sort of pain, Many of them developed severe pain, and several developed pain that was distant from the site of envenomation, suggesting a systemic exposure to the venom getting into the bloodstream potentially. Notably, 2 of these patients, 2 out of 11, were morphine was unable to control the pain in these patients. So that's really quite a high proportion. Other systemic symptoms included shaking or tremor. The writhing was potentially more a consequence of the pain rather than necessarily an independent symptom. High blood pressure and slow heart rate were noted, and nausea and sweating were also noted in a couple of patients. One patient had deranged blood tests as well. Whether that is due to the envenomation or whether that was pre-existing is difficult to say. In the 2 patients whose clinical course is known, systemic symptoms resolved within 9 and 12 hours. So it's not a hugely prolonged toxidrome. So in summary, serious cases of lion's mane jellyfish envenomation have been reported to the NPS, and for me, the most notable symptom is the severe pain. This is probably neuropathic, directly with the venom directly acting on the nerves, and so therefore, if morphine is proving ineffective, it's reasonable to switch away from that early. No deaths were reported to us, although high blood pressure may put patients with underlying conditions such as risk factors for stroke and heart attack at increased risk. This was a retrospective review of cases reported to us, and cases reported to us in general tend to be on the more severe side. Local experience of these jellyfish stings may be more comprehensive, although maybe less severe and less concerning. Here is a sample of the literature. A similar syndrome of high blood pressure, and in this case high heart rate, was reported by Mahon and Mallison in 2020. This was also in a Scottish lion's mane. And the only reported death was Conan Doyle's fictional account in one of the Sherlock Holmes books, and that was based off the earliest example of an envenomation I could find, recounted by Woods in 1874. So thank you very much for listening. I'll be very happy to take any questions by email.